Which of the following histopathological features is most likely to be seen in this mass? Papillary structures with a fibrovascular core, small uniform cells with round nuclei, cystic spaces filled with cholesterol crystals, thickened collagen bundles and spindle cells, or Samoma bodies and a whorled pattern of cells. A 9-year-old boy presents with a 4-month history of headaches, impaired vision, and increased fatigue. His mother mentions that he has been gaining weight and complains of frequent urination. On physical examination, the boy has bitemporal hemianopsia, and laboratory tests revealed elevated serum glucose levels. MRI shows a suprasellar mass with calcifications. The mass is found to be derived from ectodermal remnants. Okay. This sounds to me like Rathke's pouch, like a Rathke's pouch tumor. I forget exactly. It's a pituitary adenoma, not pituitary adenoma. Um, Sorry, my dog's in the background. I apologize.
Oh, no,
Um,
you're good.
I would call this probably. I don't think it's. Wait. I don't think it's not the cholesterol crystals. That's a fat emboli or something like that. And so it's not that one. This is kind of where I'm struggling just with this right here. This is kind of where, like, to me, like, you have to know the details.
Sure. Sure.
And
So,
because, yeah,
yeah.
yeah,
Go ahead. I was going to say, test taking strategy wise, right? Sometimes, you get into kind of this situation, and I can't even like. I think your diagnosis is correct, right? And I think you've done the first step. So I guess the question is, if you don't know kind of this on the front end, do you spend a lot of time or a little time? You know what I mean?
yeah. And so I'm leaning towards papillary structures. I was
Yeah.
trying to rule stuff out. I think a small uniform is like rather meningioma or ependymoma, one of the two. Samoma bodies, I think, is actually the meningioma. Thinking collagen and bundle, I don't think that's what it is, and so I'm thinking that's what it is, but I would probably spend less time on this one.
Perfect. Yeah. Test taking strategy. So good. So you went with your gut. So craniopharyngioma, right? Ectoderm remnants of Ranke's pouch, right? So good. You got the diagnosis. To me, that is like 80% there, right? And like I said, sometimes after you get the diagnosis, you kind of just add this to it, right? So this is a histology question, right? As long as you got the diagnosis, you're 80% there. Now you just tack on this extra piece of information that is papillary structures with fibrovascular core. Did I personally know that? No, I do not remember that histology. I'll be the first one to tell you I don't remember that. But on a test taking standpoint, right? When you get this right on a practice test, you get this on practice questions, right? You just want to be like, okay, so I know the diagnosis score, right? That's a +1 for you. And then, all right, if you don't remember kind of histology, you want to pick an answer and learn from it real quick, right?
True.
So
Yeah.
small uniform cells with round nuclei, that's going to be like Ewing sarcoma, right? They're blue, right? It kind of looks like lymphoma, right? On histology, cystic spaces filled with cholesterol granule crystals are cholesterol granulomas, right? This is really rare. This happens in ENT a lot. We get tested this a bunch, but you can get it in the Petrix apex. You don't really get it too much on step one. Very, very low yield topic, I would say, on step one. Spindle cells, right? Fibromatosis, also super, super rare on step one, I would say. Samoma bodies, you will see this, right? Whorl patterns of cells, meningiomas. Okay, you will see that.